And you can actually go online and download a list of questions that you ask a surgeon before you have surgery. Know what you want out of this surgery and to make sure that your doctor is on the same page, that he's compassionate.
Hi everyone, my name is Dr. Rita Roy, CEO at the National Spine Health Foundation, and I'm your host for the Get Back to It podcast, where we tell real stories of healing and recovery. What does it mean to get back to it? It means overcoming injury through treatments that work in order to return to the people and activities you love, whatever that looks like for you. It means getting back to your life. We're here to share the success stories of those who did just that. And some of these stories you are not going to believe. At the Get Back to It podcast, our goal is to tell stories of spinal champions who've been able to achieve a better quality of life through spinal healthcare. Today, we're sitting down with spinal champion Ellen B. Ellen's journey to healing and recovery lasted about 15 years. Having first experienced symptoms in 2002, it was a surgery and stem cell treatments in 2016 that gave her new pain-free life. What happened in between? Stay tuned to find out. Now that you know what to expect, let's get back to it and dive right into Ellen's story. Ellen's first symptoms occurred in 2002 with severe pain in her neck and shoulders, which was described as referred pain.
For several days, I was severely impacted and was not able to work or take care of my family. This went on for about 4 days at that pain level before I made a visit to my general practitioner.
The severity of Ellen's pain came with a tingling sensation in her left hand fingers. According to her GP, those symptoms were most likely being caused by nerve impingement in her cervical spine. That means her neck.
I went to my GP, got x-rays, and had an MRI. I then had my first appointments with a neurosurgeon. I was treated for spinal stenosis for several years with epidural steroid injections using fluoroscopy machine under the guidance of a pain management physician. My regimen also included pain medications and muscle relaxers. These treatments allowed me to continue to work and to care for my family.
Over time, however, the tingling in Ellen's hands progressed. She was dropping things, and the pain in her neck and shoulders flared up again. It seemed as though the epidural steroid injections were no longer working.
I was seen by my neurosurgeon and was told that I would need to have a fusion at C3-4 in 2007. I continued to have pain post-surgery and even while still having the epidural steroid injections.
Ellen was then told that she would need another procedure, a microendoscopic discectomy at C6, C7 in 2010. Not much later, she was told she would need another fusion in 2011.
At this point, I fought with insurance to get 2 artificial discs rather than having another fusion. I tried listening to my body. I was having more radiating nerve pain in my left arm and it was getting weaker. Unfortunately, artificial discs were not yet approved in the United States. My only option was fusion at C4-5 and C5-6 in 2012.
Later, in 2015, Ellen started having daily occipital nerve pain, which was treated with more injections. Due to the domino effect of having many fusions, she was told that she would need to have another one. Fusion was recommended at C6-7. It was at this point that Ellen discovered a new surgeon who gave her hope.
I was fortunate enough to hear about a surgeon in California who would consider removing the fusion from C5-6 and using an artificial disc at level C5-6 and C6-7. I had stem cell injections to treat the occipital nerve pain at the time of surgery.
Ellen's 2016 artificial disc surgery was a great success. She was immediately pain-free after her 15-year-long journey. As we stand, 4 years later, she has not had any more injections or other treatments since this surgery.
First and foremost, make sure that you do the due diligence necessary in finding the most capable pain management team in surgery if necessary. The continued fusions brought relief, but created more issues for my lumbar spine, both above and below fusions. The dynamics of spinal procedures are progressing all the time to make things better for the patient. Don't wait to address the nerve signals your body is giving you, and don't give up.
Ellen, thank you so much for being willing to come on our show today and to share your story. I can only imagine how frustrating it must have been to go through fusion after fusion and still have persisting issues. You talked about some of the limitations of insurance and certain treatments being approved for use in the United States. How did it feel knowing that there were treatments out there, but not yet available to you?
This was a very, very frustrating time for me. I was becoming very depressed and becoming more frustrated and very persistent, as I would call the insurance companies, my doctors, my surgeons they would have to do appeals for me to get even some of the MRIs that I needed. And knowing that I wouldn't have to have another fusion, which meant that I would have been fused for 4 levels, and that would restrict my mobility, was just not an option for me. To know that I could have fusion on fusion, to have artificial disc on artificial disc and not receive it was even more frustrating. And in the meanwhile, my arm was getting weaker, the numbness was getting worse.
Ellen, for the listeners who are tuning in to this podcast, can you help explain to them the difference between having a fusion in your neck versus having an artificial disc in your neck? I think a lot of times people are confused about actually what the anatomy looks like in our necks and what these differences are. So can you tell us a little bit about that and why you thought one might be better than the other?
Well, I think one way to look at it is if you took a ruler and laid it on 2 marbles, and it would just be a fixed entity. Whereas with an artificial disc, let's say that those 2 marbles were an artificial disc, they were able to move just like our vertebrae were made, where they could rotate. When you start putting that ruler on there, then your mobility is decreased and you are limited more in your mobility. You move more like a robot instead of your natural movement. It's the way we were made.
That's a really great analogy. I like that visual metaphor. I think that really helps us all understand, when we think about our neck anatomy, we are reminded that there are bones that are the vertebrae, and in between each bone are those cushiony discs. And the joints, the bones connect in the back, make up the spine. And those joints back there, the facet joints, are very mobile. So that gives us the ability to turn our head from side to side and to, twist our ears onto our shoulders back and forth and move our necks all around. When you fuse the bones together to keep them in alignment and to relieve pressure from where discs may have worn out in between. So when you fuse those bones together, you're literally causing them to be stuck together so that they all move in one piece. And so when you talk about losing that mobility, you literally can't move in the way that you normally would. And so when people are thinking about putting artificial discs in their neck, a term that's often used is motion sparing, right? We want to preserve the motion as much as possible in your neck. And so for many people, a combination treatment of a fusion and an artificial disc can be the best treatment. But I think what's important here in your story is the journey to finding the right treatment for you. And Ellen, I can't believe this went on for 15 years. During that 15 years time, were you seeing just one surgeon consistently throughout that time? Can you talk to me a little bit about, how you went about selecting your medical team?
Well, as you can imagine, over 15 years, that was quite a process. First, it was going to the GP, and then, fortunately for me, one of my best friends had already gone down this path. So I went to the neurosurgeon that she had seen, and I started with him. But I don't think that you should ever just go to one surgeon, especially when you're considering a major procedure such as this. I went to another surgeon to follow up, just to find out what he thought, if they were on the same page. And I was very open about getting second opinions. I mean, the reason I'm here is for a second opinion. And then I felt confident with my first neurosurgeon that I went to, that my friend had used. And so I went ahead and went that route. Being very naive about this whole procedure, when I first had my first fusion, And surgeons are surgeons. They don't explain things in layman's terms. And I didn't realize when I had my first surgery that if I had to have another one, it would be due to that, as I refer to, the domino effect. Because when you have a fusion at one level, it will have an impact the level above and the level below. So, of course, I got medical books and old school and went on the internet, which can be very dangerous. So you have to be very careful when you research on the internet to find out, what options were out there, what would be the lasting situation with me and my neck. After having the first fusion, it was pretty obvious that this was going to be something I was going to be dealing with for some while. And if I had it to do over again, although artificial discs weren't even approved at the time, I think with my very first one, I would have done an artificial disc from the get-go. And my surgeon was very knowledgeable. So that you have to be your own advocate, you have to do your own research, and you have to feel good about the surgeon that's doing the operation.
Ellen, those are such great words of advice. At the National Spine Health Foundation, we are on a mission to educate Americans about their treatment options and about the innovations that are happening in the spinal healthcare world. We are the only patient-focused nonprofit organization out here focused on delivering education and conducting clinically relevant research and advocating for patients. And until very recently, the educational materials that we've been producing haven't been readily available. And so we're very excited to be here now and to have people like you come on and tell us their stories so that we can share that information with others. 100 million Americans are affected by spinal conditions every year. That's 1 in 3 people in America. That's a huge number of people that are suffering. And so we are here to give hope, to let people know that, to do the kinds of things that you're suggesting, Ellen. Many members of our medical and scientific board, who are the top spine surgeons in the nation, helped produce a Spine Talks program for us. And one of the things that we ask them is how do patients pick the right doctor? And I think, to your point, be very honest about getting second opinions. No surgeon should feel unhappy with a patient who wants to get more information or to get more opinions. If anything, that should be applauded. So congratulations, Ellen, on doing your due diligence and doing your research. That's fantastic. And talking to people and having trusted resources like spinehealth.org and spinetalks.org, which are the websites that the foundation puts out with truthful, vetted information for people. It's the one place that you can come to get information about treatments and understanding the types of questions that you need to ask a surgeon when you find yourself in that situation. So much has happened in terms of innovation in spinal healthcare in the last few years. Ellen, you've talked about not having access to treatments that are approved in some countries but not readily available in the United States. I'd like to ask you, sort of on this long journey, Ellen, that you were on, so many surgeries, so many procedures, injections, what kept you going? What gave you hope? And what kinds of things were you hoping to get back to? What was your inspiration to keep searching for answers for your pain?
Well, one thing that is a personality issue probably is that I'm relentless. When I think that someone, such in this situation, when you're discussing having a 4-level fusion is compared to knowing that there's an artificial disc surgeon out there, I was relentless. I had to have the best of the best, having already been down the road of having the fusion, seeing that was only going to lead to more fusions, even with the best surgeons. I mean, that's just the dynamics of it. And so for me, it was sheer luck to come across the surgeon in California that did my surgery, where he did the artificial disc. I mean, it really was just luck. After hearing about him and doing some research on him, doing my own due diligence, as I keep talking about, I found he was an incredible individual. And of course, we met, or we talked over the phone, and then met before we even went down the road of the surgery, which is also a very important thing. And as far as getting pain-free, just sticking with it, there wasn't a choice. I'm a very active person. The pain, and to live in pain and raising a family, and it is just the most incredible journey that you can go down. But you just have to keep putting one foot in front of the other and just pushing forward. And I'm not a big advocate of pain medication or muscle relaxers and all the medications that you can take, but those did, I have to say, help me get through a lot of days when I didn't think I could make it through it. And then, of course, once you get the surgery, it's an immediate relief, because then the nerves, the stenosis is, not there where the nerves are being impinged anymore. And then you think, and things are great for a long time. One of the problems that me personally, which I don't know is totally pertinent here, is that once you've had these surgeries, you're not supposed to lift and do all these things that, over 20 pounds. And for a very active, independent woman, that was very, very difficult for me.
And are those recommendations long-term, or were those short-term recommendations while you were healing?
Well, those were short-term while I was healing, but it was put to me in a way is that because I'm a fairly strong person, if I continue to lift heavy weights, then I won't be I'll be back in pain. I'll end up having a rupture or something at the disc level below or above, and it just wasn't advised.
Okay, wow. That's tough. That's tough news to have to hear, for sure.
So anyway, that the pain, yeah, it really is. It stinks. It was a long time, but once you get it remedied, oh my goodness, it's remarkable, absolutely remarkable. And I believe in the stem cell injections for the occipital nerve pain that I had. I'm a big believer in that. But I do, once again, you have to be your own advocate. And there are a lot of people out there touting stem cells for things that stem cell injections will not work for.
Ellen, can you tell me a little bit more about that occipital nerve pain? Talk to us a little bit about why you think that happened. What is occipital nerve pain? And how did you arrive at considering stem cells as a treatment for that? Can you go into a little more detail about that?
Well, I'm definitely not a doctor or even a nurse, but the occipital nerve pain, occipital, which comes from behind your eye, is exactly that. And the pain occurs at the base. For me, it occurred at the base of my skull. And it would be like having a headache every day. And there was no amount of medication that I would even I wouldn't even recommend to try to get rid of that. And so I had that for several years. And we had done epidural steroid injections with my pain management doctor, and I would get relief for 3 or 4 days. And
Ellen, where do they, when they do the epidural steroid injections for the occipital nerve pain, where do those injections occur?
Those injections occur at the base of my skull in the pain areas that I was having, but it also goes into your spine, not the spinal canal, but into the vertebrae, just like when they do the steroid injections for the referred pain in my shoulders. Right. So, but there are trigger point injections they do, and that is more what the occipital nerve pain injections are. They're pinpointed.
Got it. And so you were doing injections for the pain, and those injections were they steroid injections, and then you moved to looking at stem cells?
Well, yes, those are epidural steroid injections, and there's a myriad of different medications that they put in whenever they do injections, depending on the site. But the stem cell, actually, I had never thought about it until I talked with the surgeon that was going to do my double artificial disc. And he said, Ben, there's shown great outcomes from this. And I also had a really bad knee at the same time. And he said, we'll even inject at your knee. and we'll do this while we're right it during surgery so that you don't even feel any pain. Not that it's very painful, but it'll be injected during surgery. As soon as
Wow.
I got out of surgery, I had no pain in my head, my neck, nowhere, but it did not work in my knee. The pain in my
Interesting.
knee was exactly the same. So this surgeon, he knew he knew that it had been successful with his patients in the past, and it was successful with me.
So that's great. So the surgeon made this recommendation to you, and you've talked about doing your due diligence in finding the right surgeon to treat you with the right treatment approaches. Can you tell us a little bit about what that due diligence involved? You mentioned that you had a friend who had some spinal conditions and had been down a similar path as yours. Can you talk a little bit about what that was like, and were there other people who you spoke with? Maybe what some of those second opinion interviews were like?
Yes, my friend that had these surgeries and she was contemplating going to Australia to get the artificial disc on artificial disc. That's how resolute she was. But this was probably 5 years before I actually had that surgery. And you can actually go online and download a list of questions that you ask a surgeon before you have surgery. Some of them are helpful. Some of them are fairly ridiculous. Know what you want out of this surgery, and to make sure that your doctor is on the same page, that he's compassionate. I also had a couple other friends who had neck surgeries, so I reached out to them to find out who they had used, ask them what their situation was, their pain levels now, what type of surgeries they had to go through. And that's also very informative. But you can do so much research on the internet, and after a while, you'll find the reliable source. You can tell, if it's Johns Hopkins Hospital or Cedars-Sinai. But I highly recommend going to the top of the line, the upper echelon of medical care to do your research. You need to check out the National Spine Health Foundation because they're a very valid source of information, and it's very helpful and has been to millions of adults.
Ellen, one of the things that you talked about in telling us about your journey is this idea of not waiting to seek treatment. Don't delay getting help. Tell me what that means to you. What do you mean when you tell us that?
Well, once again, it's kind of my personality, but I didn't just, I'd had a couple of fusions already, and here my arm was going numb again, and I knew all the symptoms. I had already been down this road, and I thought, oh, no, we're not going to do this again. But I fought with my insurance, and my neurosurgeon that had done my other fusions, he really did fight for me in doing appeals. He did doctor on doctor reviews with the insurance companies. He really went above and beyond. And they were not going to relent. They were not going to approve it. It was not FDA approved, so it would have to be off label. And I just happened to be able to find a surgeon. And then I waited a year. And as that year went on, I could feel dropping more things because my hand was getting weaker. My arm was radiating just burning nerve pain every day.
Goodness.
And I am like, no, I am not having another fusion.
Yeah.
I just can't. I can't operate like that. And so, and discuss this in its entirety to him. He is like, and these aren't his words, these are my words. My opinion from him is, I want to make you better.
Mm-hmm.
And I'm not going to go by what the insurance company is going to tell me I can and cannot do. So I knew that he had a lot of credibility. So it's not inexpensive, I will say that, but because the insurance would only cover one level. So the other level you pay for yourself. So that's what we opted to do. My husband was very supportive. We went down that road, and I am so grateful. And because my outcome my life would be totally different now if I hadn't done the artificial on artificial.
That's amazing, Ellen, that you persevered through the insurance issues and were able to find a surgeon who said, I'm going to do the right thing for you, regardless of what the insurance companies want to cover. And yes, there is cost with that. And yet there is the lost opportunity cost of your life, right? So it's frustrating that it's an expense that you have to endure. Thankfully, you had the ability to do that, and you had the family support to be able to get that done and to be able to return to your life, because you can't put a price tag on that, right? I mean, that's just something you can't. It's it feels silly to say there's no amount of money that can give you your life back, and so it's really quite a quagmire to have identified what the right treatment for yourself would be, and then feel like you couldn't have it, or you couldn't get it, and that something as simple for your surgeon was to not worry about that cost. Like, we're just going to do this. We're not going to worry about what insurance will or won't cover. We're going to get you taken care of, and that you were able to have the resource to be able to do that. That's just a very powerful story. Ellen, what would you say to someone who, like you, has been on a long journey and has not yet found their pain-free life?
Oh, wow. I am so sorry. Number one, for that person. I just stay steadfast. I mean, there is a resolution. And if it hasn't been discovered yet, it will be discovered, because innovation, like you had said earlier, they're just making such progress with spinal issues, and just stand firm. And if you even have to take out a loan or get a healthcare loan, those are out there for people, so that you can actually get done what needs to be done.
Mm-hmm. Yeah, that's great advice. Really, really good advice. And yes, the advances in spinal health care are everything from minimally invasive surgeries to regenerative medicine, like the stem cell treatment that you had, operative, non-operative treatments, looking at evaluating those, what is going to be the right approach for you, because no two people are alike, and no two bodies are alike, and no two bodies respond in the same way to treatments. So you've got to feel that you're in the hands of a compassionate surgeon. It's a very intimate relationship that you develop with your surgeon, so you have to feel comfortable with that, and you have to feel like you can ask questions, and no question is too silly to ask. Sometimes our beloved surgeons don't talk and people talk, and so we've got to feel like we can slow them down and ask them to speak to us in regular people talk, and that's got to be okay. So I think all the things that you did, Ellen, and all of your advice and recommendations are just spot on for everybody. And I'm so thankful that you are telling us all of this today, that we are able to sort of listen to your story and learn from that, and learn from your lessons learned. I think that the perseverance that you've demonstrated in getting yourself back to your life is to be celebrated. We congratulate you, and we just thank you for giving hope to other people who really just don't know what to do, or feel that they're out of ideas. That there are innovations that are continually coming up, and you might have to travel to find the right doctor, but hopefully there's somebody close by that's one of the top surgeons who can help you. Ellen, did you say that you had to travel to California?
Yes, I live in Texas, and
Wow.
so I went to California and stayed there for 2 weeks. Because I had to do my follow-up appointment and things such as that. And then the rest was, we could just do the MRIs at my facility in Texas, and then mail them, or send them to the doctor. Then he could review them, and then we'd do a phone consult. So it actually required only one trip to California for me.
Wow, that is amazing. I mean, that's just an amazing level of commitment and perseverance to your wellness journey, Ellen. And I think, the bottom line here is that it's worth it, right? Look at your life now. You've got your life back. So that's just fantastic.
You have to start small, okay? You have to start first with your general practitioner. Don't just jump in and think, okay, this is, or self-diagnose, and or even if your general practitioner tells you that you have spinal stenosis, or that's what they suspect, or that's what the MRI report said, or whatever, still there are so many proactive things you can do before you get to that point, and make sure that you go to physical therapy. Make sure that you do your own stretching at home, or things that are kind of like a prelude to you going to a surgeon. Because once you go to the surgeon, you really have to make sure that you are committed, because this hasn't changed that much, because you'll have a collar on for cervical, you'll have a collar on for 6 weeks, at least. And that is changing. I know that may not even be true today, and it's not just that, but it's all the issues that come with having a surgery, and it is a last resort, and you can try acupuncture, you can try the steroid injections, that I had done for years and years, and they worked a lot of the time, but a lot of the time they didn't. So just make sure that you don't just jump right into the surgery. You do everything you can do to keep from having that surgery, but don't wait too late.
That's great advice. I think that many spine surgeons would agree that you'd want to exhaust all non-operative approaches before you end up in surgery. And just about every spine surgeon out there would probably agree with that. So I think that's really great advice. Ellen, it has been a pleasure meeting you. At the National Spine Health Foundation, we believe that something truly beautiful happens when spinal champions like you share their stories. You being here today helps us tell others out there in our community that they are not alone, and we are so, so grateful to you. Thank you, Ellen. Thank you so much for sharing with us.
Thank you, Rita. Y'all have a great day.
Thank you. At the National Spine Health Foundation, something we believe in most is providing hope for recovery through sharing stories of success and expertise. It isn't always easy to find someone to relate to, even though 100 million adults suffer from neck or low back pain each year. To hear more stories of recovery and access educational materials about spine health, visit us at spinehealth.org. If you're interested in supporting our show financially, you can contribute at the link provided. Thank you for listening. The information and views expressed in the Get Back to It podcast are intended for informational purposes and should not be used as a substitute for professional medical advice or to replace the services of trained healthcare providers. To view the National Spine Health Foundation's full disclaimer, visit spinehealth.org.